Hi, my name is Claudia Yatskin, and I will be presenting on medulloblastomas, which are primitive neuroectodermal tumors, grade 4. The table of contents, so I'll go through a quick introduction, then identifying the information, classification, etiology, gross and microscopic views, and then clinical questions. So first off, the introduction. So a medulloblastoma is the most common primitive neuroectodermal tumor recognized in the WHO classification. It is a grade 4 tumor, meaning that they are malignant and very fast growing. And here we see an image of an MRI of a medulloblastoma. As we see, it is in the midline and it's in the cerebellum. So identifying information, so the location. So as we saw in the MRI before, it arises in the cerebellum. In children, it arises in the midline vermis, expanding into the fourth ventricle. And this tumor is mostly seen in children, but it can be seen in adults, and it occurs mostly in the cerebellar hemispheres in the adults. Age presentation. So the age presentations ranges from 3 to 9 years old, but the peak incidence is 7 years old. It can also occur in adults, ranging from 20 to 45 years old. And here's an MRI image of a medulloblastoma, and we can see it invading the fourth ventricle. So now on to classification. So we have two separate classifications. We have the WHO classification, and it's subclassified into 4 groups. We have the WNT, which makes up about 11% of the medulloblastomas. They're mostly found in children, can be seen in adults, and rarely seen in infants. And this is the medulloblastoma has the best prognosis. Then we have medulloblastomas that are categorized by the SHH, which is the Sonic the Hedgehog gene. And this medulloblastoma is seen in 27% of medulloblastomas. It's mostly seen in adults, infants, rarely in children. And it has a kind of medium, intermediate prognosis. And now into group 3. Group 3 is about 24% of the medulloblastomas. They're mostly seen in children and infants and rarely in adults. And this is the medulloblastoma with the worst prognosis. And for group 4, it makes about 34 to 40% of the medulloblastomas, mostly encountered in children, some adults, but not in infants. And that is, the prognosis for group 4 is intermediate. There's also other classification, which is histological classifications, and that's divided into medulloblastoma classic, mesoplastic nodular medulloblastoma, medulloblastoma with extensive nodularity, and then the anaplastic medulloblastoma and large cell medulloblastoma. So cerebrospinal fluid dissemination is common, so it can metastasize, and about 1/3 of patients present a leptomeningeal tumor. So basically leptomeningeal means that it can be seen in cerebrospinal fluid and in the arachnoid and pia mater. And they have a very poor prognosis as well. Now on to etiology. So they arise from stem cells. So the tumors arise from stem cells of the fetal external granular layer or periventricular germinal matrix. And in the picture on the right, we see the germinal matrix identified. And specifically for the WNT tumors, arise from progenitor cells of the lower rhombic lip. And I also put an image of where the WNT1 is expressed. WNT are mostly presented in classic anaplastic and large cell tumors. The Sonic the Hedgehog classification is normally arises from the vermis of the cerebellum, which is also classified into group 3 and group 4, but can also be seen on normally arises from the vermis of the cerebellum, which also group 3 and group 4 do, can also be seen in the cerebellar hemisphere. And then the Sonic the Hedgehog it can also be classified as desmoplastic and nodular. A group 3, we see a specific mutation in the MYCN gene, specifically a gene amplification. For large cell and anaplastic morphology, the MYCN amplification, MYCN oncogene, and it is the most aggressive and therefore has the worst prognosis. And then there's also associated syndromes that can be associated with these tumors. And these are two examples, Li-Fraumeni, which is a P53 mutation, and the Coffin series syndrome, which is an ARID1B mutation. So this is a gross view of the medulloblastoma. They're usually solid, soft, fleshy, kind of white gray tan mass in the cerebellum and in the fourth ventricle. And these images show just that. And these now we're going to go into histological views. So this is a medulloblastoma classic. And it's characterized by small blue round cells, as we can see in the first image up top, also in the second image. They also have round or ovoid nuclei, can form home or right rosettes, as you can see in B, forming rosettes, and can exhibit slight to none cytologic pleomorphisms or cell remodeling. So some can have it, some may not. Now into desmoplastic and nodular medulloblastoma. As you can see, this is characterized mostly by round pill nodules. As we can see in the images, they're separated by darker nodules. They're composed of round and spindle-shaped cells. They're neurotically differentiated cells, and they show desmoplasia, which is pericellular collagen deposition, as we can see in the images. Now, a medulloblastoma with extensive nodularity. So these are very highly differentiated, and they're similar to the previous one, as we can see here. But the difference is in the desmoplastic and nodular, they're not interconnected. Like the nodules are like little islands. And in the extensive nodularity, here we can see that they're kind of form linear streams of connections. Now on to anaplastic medulloblastoma. They have a marked nuclear pleomorphism. They have nuclear remodeling, cell-to-cell molding and wrapping, frequent mitotic division, increased cell size, and frequent apoptotic bodies. So you can see this is kind of a little bit more different and a lot more pleomorphism than the previous images. Now, lastly, we have the large cell medulloblastomas, and their monomorphous population of large discohesive cells with nuclei that have prominent nucleoli. And these are examples, as we can see here. Again, very different than the previous ones we saw. Now, on to our case questions. So a 7-year-old child presents with a worsening headache, waking from sleep, and MRIs performed shows a posterior fossa tumor and secondary obstructive hydrocephalus. The solid component of the tumor has low ADC values. What is the most likely diagnosis? So as I said before, we saw this tumor, again, mostly in the cerebellum. So that would be in the posterior fossa. And because it blocks the fourth ventricle, it would be an obstructive hydrocephalus. So what would it be? It would be a medulloblastoma. And lastly, a 20-year-old female presents with raised intracranial pressure. What is the most likely subgroup of medulloblastoma is shown on this post-contrast axial T1 image. So the clue here is a 20-year-old female. So which one would mostly be seen in adults? And it would be Saanich hedgehog. And yeah, these are my resources. Thank you. Any questions?